How do we plan a rhinoplasty or nasal surgery operation? It really is a team effort between the doctor and the patient. With rhinoplasty, it's essential that we consider elements of balance and elements of function. When I'm talking about balance, I'm talking about both the balance within the nose, in other words, when we change one section, how that affects other sections of the nose, but also the balance between the nose and other parts of the face. For example, if we look at the profile and we see a nose that's a little perhaps too strong, but a chin that's a little weak, sometimes the solution is actually working on the nose to reduce the profile, but also adding support to the chin in the form of a chin implant. Functional considerations are equally important. We never want to sacrifice the breathing of the nose for achieving an artistic result. And we need to look not both at just at the short term, but also at the long term with this surgery, so that we give our patient a nose that looks and breathes well for many years. A couple of good examples. We've really moved from an era where we were just taking things away from the nose to where we're sometimes taking away and sometimes adding. For example, in a profile analysis, you may discover that it's not just that the patient has a high profile of the nose, but that the root of the nose is a little low. So if I add a small cartilage graft in that area, we can get a beautiful balanced result and not have to lower the profile as much and keep a nice natural line. This is also true in terms of breathing mechanics. Often we'll add small cartilage grafts that can help to support the middle third of the nose so that the nose breathes easier. I think ideally you want a nose that is good for the long term so that it looks great now and breathes well, but also in 20 years you still have a very good outcome.